Andrew, I want to first introduce you, or maybe you can tell us a little bit about yourself. Introduce yourself, and we're just extremely lucky to have you on today, and just kind of talk about what you do. I think we were just kind of talking about how instantly connected we all felt when we met up in person a few weeks ago. So I'll turn it over and have you introduce yourself and tell us a little bit about your company and what you do.
Sure. First of all, thank you for having me. This is fun, and we want to talk about how we can imbue the work that we all do with fun and joy. And so
absolutely,
I think there's a parallel process going on, because I really enjoy interacting with the both of you, and it's fun for me. So I'm psyched to be on your podcast right now. Thank you.
Feelings
Thank
mutual.
You so much.
Likewise.
Feelings mutual,
Likewise.
brother.
I am the founder of a program called BODA Therapy. We do a couple of different things. We do short-term retreats up in the Catskills. We do experiential DBT and CBT-based psychotherapy. We run an accountability program that helps you to track things like sleep and exercise and holds you accountable to certain self-care behaviors. And we are an adjunct to, I would say, conventional psychotherapeutic work. So we'll work in tandem with a therapist for clients that just need a little bit more than just that 45 to 52 minute session in an office. I love working collaboratively. I love working with other people. And I think the work that we do is immersive. It's dynamic. It's fun. We're about creating experiences for people, and we're about making it fun, whether we're doing this adjunctive work with a client, whether we are on a retreat with a client, or even if we're trying to hold a client accountable for not being on their screen all the time. We try to imbue the work with fun. And I'm psyched to talk to you guys about that. Just making it fun.
It's so cool. We do one thing here that, because we're committed to being sort of no jargon. I was just wondering if we could rewind a little bit. You were talking about CBT, DBT. Could you explain that for any listeners who may not be familiar with the term?
Yeah. So we, the work that the therapists in our practice do is primarily skill-based. So we take this very pragmatic approach in particular in the psychotherapeutic work that we do. So if you're seeing us as your primary therapist, we're going to give you skills to tolerate what you feel, skills to be in the moment, skills to interact well with people, skills to just accept whatever's going on in your life. It's definitely an approach that it's not the only type of therapy we do, but we try to lean into that whenever we can.
So cool.
Yeah. Kind of as a core, maybe just as a maybe a bit of an intervention, using some of those skill based. I mean, when I think of CBT, and we've talked about this, a lot of the, negative kind of, thinking styles and some of the thought loops that we get stuck in, and then going through okay, here's some skills to actually undo those and to counterbalance, some of the negative loops that we get stuck in.
Negative thinking patterns, the negativity buffet, we've called it.
Yeah.
I'm going to have a big helping of, all or nothing thinking or catastrophic thinking with a side of mashed potatoes.
I think we all eat at that buffet, by the way. I think every human eats at that buffet. So, I love the work that we do, because it also gives me skills that I can use in my own life.
Right.
Totally.
Right.
So
totally.
I love that.
So tell us a little bit more. And I think the thing that really stuck out to Kenyon and I, and what we talk about often is this idea of joy, and that therapy can actually have some joy in it, and that recovering from anything doesn't have to be a constant experience of pain.
Right.
I mean, we all walk around with that stuff anyway. So I'm just wondering, how does joy play into this? How does this idea of having fun in recovery work?
Wow, it's such a huge question. I think in warming up to the question, can I tell a little creation story of how?
Please.
Yeah. So I worked for 15 years in a psychiatric hospital, inpatient psychiatric hospital. And I think the first week someone said to me, if you're not laughing, you're crying. And it was a very extreme statement, but something about it stuck. This idea of, okay, I can exercise some level of choice, what I want to bring to a situation. Can I try to find amusement? Can I try to find humor in a dynamic? And it's not possible in every moment, for sure, but it started me on my personal journey of like, what meaning can I make in any given situation? And so I started just really leaning into, I'm going to try really hard to find the joy and find the levity and the fun in any situation. And that led me down a direction in terms of the work that I did. I studied theater. I made music with my friends. I consider myself to be a creative person. And ultimately, the hospital let me infuse all those passions into the work. And I ran a recording studio in the hospital. I ran a theater program. I ran this fun meditation program. And it allowed me to find the fun, find the joy through creative, collaborative experiences.
And what was that like for the patients? Like, what kind of outcomes and results do you see when you're engaging them creatively and focusing on fun and joy?
Less resistance, more presence, more willingness to engage in the process of like looking at their stuff, being willing to be vulnerable, to be wrong, to try something new, to put in effort towards doing the work and learning a skill or admitting that they're wrong. So I found just like this greater amount of willingness, but also just to bring it back to the theme, I'll give you an example. Someone would come in and they talking about their dad and how they were angry at their dad. And that would lead to writing a song. Mm-hmm. And then we'd be working on the song together and we'd be like, what's the hook? What's the hook of the song? And then we'd make a beat and then we'd be listening to the beat. We'd be really vibing on the beat. And then we'd be working on the chorus. And then when we both kind of came to what the chorus was, there'd be this just joyous eruption of excitement. Like, oh, we found it.
Yeah.
And I can't underscore how amazing that felt for me. Right. Just I'm in it with them and we're on this journey together.
That's amazing.
And I feel the word's blessed. I feel so blessed that I got to every day. I was so close to the fun.
Yeah.
And so close to the joy.
So cool.
It's interesting, that process that you just described. I think we've talked about that before, just from a clinical kind of vantage point, but because you kind of just explained like the therapy process, the thing when it really happens, right, in a room where you're sitting with somebody, but also just in life, like when we've talked about the importance of connecting with other people, and it's and I think whether it's around something creative and or in a clinical setting, there's this magical thing that happens when people like have this joint experience, that all of a sudden it's like, oh my God, we've achieved this thing. It's amazing.
Collaborative.
It's collaborative, and there is this connective energy that happens, and I think it's so cool to hear that you were doing it in like a hospital setting where I think historically
it can get really
pretty
grim.
dark. Yeah. Right. And then you had and there was this, you could really just find this joy, and it wasn't about like some therapeutic breakthrough like from a textbook. But when you think about what you just explained, that is such a breakthrough for somebody to be able to have that experience in that setting with another human being sitting next to them.
Yes.
The creative act.
Yes.
It's a wonderful way in, because not everybody you're working with in that setting obviously is going to be a creative person who's used to producing music, for example. So how do you get them in? Like there's an art to that. You talked about before, we were having an offline conversation about this, like when you're trying to help them sculpt the beat. And it's like, okay, how do you want to move your head to this? Right? Wasn't that kind of a thing? Like having them determine, like choose their own adventure. That's really exciting. And
it sounds like you guys access that too. You guys see that in your work, which is so exciting. Do you, when it's happening in that moment, when the connection is happening, and you found I'm going to use your words, your doorway in.
Yeah.
Are you guys fully aware of it in the moment? Or are you like,
that's a big joy. That hits a big joy button for me. Yeah. It's like, it's because it's that point of, I think James Cameron does a good job of it in the Avatar movies when the Na'vi and the various creatures are connecting. They literally take like a braid or some kind with tendrils and they connect to other organisms. Usually they're arboreal, right? They're like trees and plants and things like that, but also each other. But it does. And literally they light up. These creatures sort of light up. That's how I can feel my brain, my heart, really my being lighting up when that type of collaboration occurs, and we have, as you said, like that point of connection that can feel like a breakthrough.
Yeah, I think it's almost like this intuition, right? Because all of a sudden it feels a certain way, and if you can trust your gut on that, all of a sudden it's like, oh, I need more of this. I'm going to do more of this, and I think it's probably where a lot of people struggle. Not just people that we've worked with, like clients, but I think just people in general maybe don't necessarily trust that intuition or trust that gut feeling, but it exists. And if they can tap into it, then it's like, oh, I want more of this. I need more of this.
Yeah. That's fascinating to me what you just said. I think for people that don't trust their gut, when they have that connection and there is that like joyous mutual moment, and then they look over and they're looking at you guys, and you guys are like, yeah. And it's a way to kind of build that intuition too.
Right.
It's a way to build that gut. When you're having an experience with someone, you can learn about the intuitive nature of connection really easily.
That's right.
Right. Which is so great. I remember, like, for me, it was the music was this easy kind of place to interface around that, because
it's an amazing access point. Yeah. It's amazing point of access.
If they liked the music and they were like, yeah, they had this face like, yeah, and they saw me and I'm like, yeah. And yet I'm curious, like, what does it look like for you guys in the room when you both are realizing, oh, like, we've hit gold here?
For me, it's usually it starts with, we mentioned access points. If I'm starting with a new client, especially one who isn't very trusting, maybe they've gone through a lot of trauma, maybe they're just at a really tough place in their life. Usually they are if they're seeking therapy or somebody's forcing them to go. A lot of times, actually, I will work with younger people, younger clients whose parents are essentially forcing them into therapy. And so I just, I'll use that as an access point. Like, so you really don't want to be here, do you? And usually they'll be like, no. And I'll say, yeah, I get it. Because I had the experience of being forced into therapy when I was much younger. And we'll start there. And then, we'll go into maybe, well, what are you listening to? And whether I've heard of it or not, I'll say, okay, well, let's play it. Let's play it in the room. And then suddenly there's that, and then I'll notice, I'll see it visibly. I'm sure you've had the same experience where you'll see somebody sort of like let their guard down, and it suddenly the room, the tone shifts, and what we're doing here shifts, because I think a lot of people who show up for therapy initially and are a little bit on the fence about it, they think, okay, I'm just, it's going to be painful. This expert, quote unquote expert, is going to, shrink me or diagnose me, tell me what's wrong with me, or even worse, tell me what I need to do.
Right.
And that doesn't lend itself to any sort of opening, or any sort of connection, I don't think.
Yeah, I think that's what I look for a lot too, is just and this is, I try to walk through life that way too. And I think it's funny, as we were learning, like, going through therapy school and all the training, all these old ideas, and the structure around it was like, don't show anything, don't give any emotion, don't give any response.
Yeah.
Disclose nothing.
Yeah. And when I initially started off, I was very closed off about information and any disclosure, things like that. And I think it's funny. I think with when COVID happened and we had to switch over to video, I had to emote much more from my face in order to have a response through the screen. And but also over the years, I've just allowed myself to maybe emote more in session, but it crosses over into my life anyway with other people, with just people. And I feel like having that moment where I can see people relax.
Yeah.
And when you give a little bit of information, and when you open yourself, and it allows the other person to do the same thing. Yeah. And I think finding that harmony is really important. And that can be through music, that can be through, going for a walk outdoors. I mean, walking with somebody and allowing there to kind of level off the playing field, equalize it a little bit. And I think that's Andrew, what you're kind of talking about, like that. When I hear you talking about like creating music with somebody, there's a real equality there, right? Because you're both working in that creative space, and you can make mistakes and you can try things out. And I think it allows for the vulnerability of you, and it allows for the vulnerability of the person you're working with or the other person you're sitting across from. And when you watch that, you watch somebody's like shoulders relax, their face softens a little bit. They might sit a little deeper into the chair.
They might smile. They might
smile.
Right.
Yeah. Imagine. And in this process, somebody could smile. But I think there's a space for humor. There's a space for creativity. There's a space for a lot of this, for joy and fun and just because that's part of what I think a lot of people feel like. Oh, I can't be happy about a process in therapy or outside of. I can't show too much joy. Kenyon, I think you talked about this when we were talking about perfectionism and stuff, and how you can't show too much happiness and too much joy. You can't. It means you're not either trying hard enough or suffering enough in the process or whatever.
Well, it can set us up for vulnerability.
That's right. Which is what we're looking for, right?
Right,
so we have to model it, right? We've got to model that ourselves.
Totally. And I love the idea that you're creating a new piece of music spontaneously with your patient, with your client. Because then, as you point out, there isn't this weird power dynamic. It's not like you're teaching them a song on the piano that and they need to learn. You're creating something together. And a lot of times Chris and I have this philosophy of, with our clients, we're not the experts on you. You're the expert on you. We're here to help facilitate. We're here to, the flashlight analogy, which I never get tired of. We don't hold the flashlight for you. You're holding the flashlight. We just suggest maybe pointing it up at that stalactite over there, or.
Oh man, I love that. That reminds me, I got to share my analogy for you guys. But I think you're threading the needle through something really interesting. It's this notion that whatever experience we're creating for the client, right? If we have a client and we're doing therapy in an office, if we're taking them skiing, taking them hiking, if I'm making music with them, we're trying to create an experience that breaks down this inherent power differential that maybe has been this subtle notion in the work, maybe previous to our involvement.
Totally.
Would you guys?
Yeah.
Right.
Say a little more about that, about this power dynamic, this kind of or hierarchy, maybe.
Yeah.
I can't point to anything specific, but I can only speak to the experiences I've had with clients where they come in nervous. They're on guard because, I even had one client say to me once, like, don't shrink my head. I was like, what does that even mean? I think that speaks to this assumption that there is this power dynamic between the therapist and the client. And through experiences and through accessing the fun, I'm trying to eradicate that power differential. Totally, and that comes through being vulnerable myself. That comes through really figuring out what the client likes and trying to engage in that activity with them. That comes from letting them be in the driver's seat. And, Kenyon, I ask a similar question, like, what music are you into? But I'm like, give me a couple of your songs. Let's let you drive this experience for a little bit. My analogy, I love your flashlight analogy, guys. I just want to pause and just take that in because it's so good.
That's Chris. I love it. I learned it from him.
It's so true, but it speaks to this idea of like, you're holding the flashlight, right? You have the power. I always say, we're in a car, you're driving, you're really determining where we go. I just have the GPS. And I'm like, hey, like, there's traffic over there. Hey, they're doing construction over there. Like, maybe, oh my gosh, you're going to love this way. The view is so great.
Right.
So, but ultimately, we're talking about this experience that allows us to be vulnerable, allows us to find joy in the experience ourselves, and allows us to also try and eradicate any preconceived notion that, like, you know, we're somehow in this role, in this powerful role that is,
looking down on the client. Right.
Exactly.
Yeah.
Yeah. I've had people make statements and ask me all the time. They're like, well, how can you not be judging? Your role and your job is to judge. I was like, and I've had to step back. I mean, I've heard that for years, for 20 years. I heard it last week. Yeah. I'm like, no, it's to assess. And I think that a lot of times the assessment and judgment get conflated. But I'm like, no, I can't be in a position to judge somebody. If I'm judging somebody, there is that hierarchy then. There's that power dynamic. And there's also there's a negative connotation to it that I don't want to have exist in any relationship. So I'm not going to sit in judgment of somebody. It's more of, hey, what if I am thinking of things and kind of assessing what's going on, it's, hey, what are you really struggling with right now? And how can I be of service to you? What and how can I put myself in your life and be available for help if you need, if you choose? And Andrew, I think like the car thing, right? Like you've got the GPS. You can say, yeah, there's traffic over there. Sometimes people want to sit in traffic.
Yeah,
maybe
and you give them that prerogative.
Yeah. I mean, you know, growing up in the tri-state area, I do not want to sit in traffic. We've done our fair share of it. But, you know, I think that sometimes people want to sit in traffic. Sometimes they want to get there the quickest way possible and not take the scenic route. That's not up to us. We all we can do is make that suggestion. Right. And and then to not judge them because they do that, it's to have the curiosity to say, hey, so when you wanted to sit in traffic for 3 hours, what was going on? Did you just want to like rest? Did you just want to stop driving? What was up?
Yeah.
Maybe they have an answer for it, maybe they don't. But that's where we can be curious and ask about it instead of just being like, well, that's stupid. Why did they
Curiosity over judgment, always. Like curiosity over condemnation.
Yeah.
I love this notion of like assessment getting conflated with judgment. Yeah. And it's such an important point. You know, I'm not going to judge you if you want to sit in traffic, right? But sometimes we need to say that, right? Yeah. Sometimes we need to like, and I almost feel like part of our work is to advocate for what we believe the work can be. And I think what you're making me think of, Chris, is our work also very much is the practice of non-judgment.
That's right.
It's a meditative practice. You know, if I am sitting in judgment, I'm not my best self. I can't be present for you.
Yeah, because my big fat agenda is just like sitting on everybody in the room.
Right. How Chris really described that just opened up some new thoughts around this idea of another reason why I love what we do. Because every day I have to be non-judgmental and I have to strengthen that muscle in my brain. And I think that's another doorway into the joy.